How can you understand your pancreatic MRI report? Imagine getting an MRI scan of your pancreas and wondering what all those detailed images and medical terms really mean. Understanding your MRI report can seem complicated, but breaking it down makes it more manageable. Your report mainly describes the structure of your pancreas, including the tissue, ducts, and any unusual findings like masses or cysts. It also looks at the tissues surrounding the pancreas and nearby lymph nodes. The report will often mention the pancreatic parenchyma, which is the functional tissue of the pancreas. Changes in how this tissue appears on the MRI can indicate inflammation or scarring, which are common in conditions like chronic pancreatitis. The report also examines the pancreatic ducts, especially the main pancreatic duct, to see if they are normal or dilated. A normal duct is thin and smooth, but if it is enlarged or irregular, it could suggest disease. A key point is the size of the main pancreatic duct. If it measures between 5 and 9 millimeters, that might be a cause for concern. If it is 10 millimeters or larger, it is considered a high-risk feature that could be linked to pancreatic cancer or precancerous changes. The report also looks for any masses or lesions. Solid masses tend to appear darker on contrast-enhanced images because they have less blood supply, while cysts are characterized by their size, wall thickness, and whether they have nodules or not. The radiologist's impression section summarizes the main findings. If they see signs of fibrosis and duct irregularities without masses, they might suggest benign conditions like chronic pancreatitis. But if they notice a hypovascular mass, duct blockage, or high-risk features like cysts larger than 3 centimeters or nodules, they may suspect pancreatic cancer. They might recommend further tests or follow-up imaging to clarify the situation. Different MRI techniques help provide a complete picture. T1 and T2 sequences highlight differences between normal and abnormal tissue. Mr. cholangiopancreatography, or MRCP, is a special imaging method that shows the pancreatic and bile ducts clearly without needing invasive procedures. Diffusion-weighted imaging can detect small cancers by showing areas where water movement is restricted, which often indicates tumor tissue. Contrast agents like gadolinium enhance the images, helping distinguish tumors from normal tissue because tumors often show less enhancement. When you read your report, focus on the impression section for the main takeaways. Remember, MRI is often used when other scans like CORT are inconclusive or to better evaluate cysts. It's important to connect these findings with your symptoms, lab results like Ca-19-9, and other tests. Because pancreatic cancer can be hard to detect early, high-resolution MRI scans are especially useful for people at higher risk. Always discuss your report with your healthcare provider or a specialist in pancreatic health. They can help interpret what the findings mean for your health and guide you on the next steps. In summary, understanding your pancreatic MRI report involves recognizing key terms like tissue changes, duct size, cyst features, and how areas respond to contrast. These details help your doctor assess whether there are signs of inflammation, fibrosis, cysts, or tumors. Remember, each person's situation is unique, and only a healthcare professional can provide personalized advice based on your complete medical picture. Always seek expert guidance to understand your results fully and determine the best course of action for your health.